Good evening. That's our big focus on the show right now. You've heard of dengue, but is chikungunya what you have to worry about? 300 cases of chikungunya have been reported in the capital, and that might just be underreported. It's been on the rise. We know that in the national capital this year. It's possibly being underreported due to a shortage of testing facilities and high cost diagnosis, doctors are saying. So is this something you need to worry about? Is this another mosquito transmitted disease you need to be paying attention to? Do you want to know more about it? Do you know if you want to know how to find out if you have it? To answer all your questions, we have in studio today NDTV's in-house experts. That's Dr. Sameer Gupta and Dr. Sonia Lal Gupta. Both of them, you've seen them often on our show, Doctors on Call. If you have a question for either of them, if you want to be more informed about chikungunya, you can do so by calling in right now on 011. Take this number down. We're also going to put it up on the screen for you. 29249911. That's 29249911. Anywhere you are, please call in. These doctors are in our studios just to answer your questions. So first and foremost, you know, everybody's talking about this now. We're seeing headlines. So first and foremost, what are the symptoms of chikungunya? How does anyone know whether they should be worried, whether they should be going to a doctor?
You know, that's a great point. So, to begin with, chikungunya is a viral infection. It's a viral infection transmitted by a mosquito. So that makes it very similar to dengue, to Zika, to yellow fever. It's along the same lines. And just like dengue, it causes fever. The fever is very high grade. You typically get it in a couple of days after getting infection.
But dengue can be dangerous.
Dengue can be
life-threatening.
Yes.
And is chikungunya the same?
It is not life-threatening. Let me rephrase that. Not very commonly is it life-threatening. Okay. Very rarely is it life-threatening. But it causes severe morbidity. It makes the patient and the person who gets the infection very uncomfortable. It causes high fevers, joint pains. The joint pains are so debilitating that we often see patients coming on wheelchairs. Wow. I mean, you're talking about a 20-year-old person coming in to the hospital on a wheelchair with high fevers. You got to start thinking, does this patient have chikungunya?
You mentioned a 20-year-old. Is it does it particularly the young people? Is it old people, really young kids? Because you said it's debilitating. So I'm guessing, are some people more at risk if you're very old, perhaps, or very young? No, even though it's not as commonly life-threatening as dengue can be.
No, it's so it can be. It can, just like dengue, it can infect anyone. And the older people are definitely more frail and at a higher risk of having more serious complications. But the reason I gave a 20-year-old is because you don't see a 20-year-old on a wheelchair very often. So, just to drive home the point that it causes really bad joint pains and all that stuff.
All right. Okay. So, we do have Abhinav Shukla joining us from Delhi on the phone line who has a question. Go ahead, Abhinav.
Yeah, actually, my question is my wife, she's having fever from 2 to 3 days and she is actually having a pain in her ankle. She's not able to walk properly. So, I just wanted to know that I'm giving a paracetamol and a normal medicine. Just wanted to know if this a symptom for chikungunya or should I go for the test?
Yeah, hi Abhinav. Sorry to hear that your wife's not well. So basically the symptoms that she's having fever and she's having pain in her ankles. So the joint pain which happens with chikungunya is basically in the ankles more frequently, wrists and in the hands. So that's actually a common area where she's having it and it's already been 2-3 days. It's a good thing that you have been giving her paracetamol, until she gets diagnosed, because sometimes symptoms of dengue as well as chikungunya can be similar. So what I would recommend, since it's already been 2 to 3 days, these symptoms could be chikungunya. So you should go into the doctor, you should get her tested to rule out dengue. Because if it's not dengue, then they can prescribe her stronger painkillers which can help her symptoms. The treatment of chikungunya would be symptomatic, but she needs to be ruled out for dengue first. So please definitely go to your doctor and get her checked out.
All right, we have another caller on the phone line. Aindra Daga is joining us from Karnataka. Go ahead.
Yeah, doctor?
Go ahead, sir.
Good evening, doctor.
Hello.
Hello, good evening, doctor.
Good evening, sir.
Yeah, I am from Karnataka. I am suffering from chikungunya since almost 45 days. And the doctor has given me some painkillers, Ultracet and paracetamol. I have been taking them since almost 1 month. I was admitted to hospital also for 3 days since I am diabetic. I was admitted to the hospital. Now it's a sort of improved now. There is no joint pain or such thing, only mild pain. But I get fever sometimes. And there's a stammering in my voice, like how you can hear now. My speech is not clear. After speaking for some 1 or 2 minutes, my speech is not clear. They said they ruled out chikungunya and dengue at the hospital there. They said blood levels are all okay, 1,87,000 or something, 87,000 or something. Then I don't know when this is going to end, because still I have a lot of weakness in me. I hope you're
Yeah. So, it's very, hello sir, and it's very unfortunate that you've had a long case of chikungunya. For the most part, most people, when they get chikungunya, they recover in a week, 10 days, and in a very small percentage of people, which is the case for you, do they have long symptoms. These symptoms can last for months, and it's often joint pains, just overall weakness. In a very small majority of these people, they also have more serious manifestations of including the heart, eyes. Sometimes people have neurological issues, and and your doctor is treating you appropriately for all your concerns. But one thing which you should look into is that if you're having this new stammer in your voice, if your voice has changed, then I would recommend that you go to the hospital as soon as possible, get yourself checked out, because you want to make sure it's not anything else. You had dengue and chikungunya a while back, but this is something new, and this is something which is not that common. So you should go to the hospital and get it checked out.
All right. Simi, we're also getting a caller who's joining us from Srinagar, and I always thought that chikungunya or dengue is usually tropical climate related. It's hot in Delhi right now, monsoons, water's collecting everywhere. So it'll be interesting to see what Riaz has to say. Go ahead, sir.
Hello everybody there.
Yes,
hello.
Hi Riaz.
Hi. I have a question for doctors. Please, I'm coming to Delhi, say after a week. I would stay there for 10-15 days. What are the precautions an outsider have to do? An outsider has to take while coming to Delhi. Any medicines which he needs to take with him, or any kind of special advice which the doctors, as you try to give this time?
That's a great question, Riaz. So he's traveling to Delhi. I'm sure there are many others like you. It's always good to be informed. So if you're saying there's no real treatment, prevention, I guess, is the best cure.
Right.
So what are the tips you can give viewers about how one can protect themselves from chikungunya?
Yeah. Unfortunately, right now, prevention is the only way. And by prevention, we mean, preventing yourself from mosquitoes. You have to avoid getting mosquito bites. Now, something to remember about this mosquito is that this mosquito is most active during the daytime, especially early mornings and kind of late afternoons. So you should be aware that during that time, you should always put mosquito repellents, especially the ones containing DEET is what is recommended by WHO, and those mosquito repellents you'll commonly find in any of the shops. They contain that ingredient. Other thing is wearing long sleeve clothes during the day. That is very important. If you have children, or if you'll be taking a nap during the daytime, you can use mosquito nets. Make sure in the area where you stay, you're visiting, so it'll be difficult for you. But if it's family you're visiting, they should not be having, water standing stagnant around the house, especially indoors or even outdoors, in the coolers, in the flower pots, anywhere like that, because that's where the mosquitoes actually lay their eggs, and sometimes the eggs can stay, alive for months and months together. But the key thing is use mosquito repellents, wear long sleeve clothes, and avoid, daytime, especially during the daytime, make sure that you use these repellents.
All right, Riaz, I hope that answers your question, and I'm sure you'll have a great time in your visit to Delhi as long as you take all these precautions. We also have another Delhiite calling in. That's a gentleman called Madhu on the phone line. Madhu, go ahead with your question.
Yeah, good evening. I want to know about the chikungunya. How long can that joint pain last, and do these mosquitoes bite?
How long the joint pain can last?
Okay.
How long can the joint pain last? I think that's
how
the
long
question.
the joint pain can last. And then that's a very valid question, because the joint pain of chikungunya is it's one of the characteristic features of chikungunya is joint pains. One of the ways that doctors differentiate chikungunya and dengue is by the debilitating joint pains of chikungunya. And the joint pains can last anywhere from a week to 10 days. That's most common. But in rare cases, like the gentleman before you, it can last for months. But that's not very common. Most cases of chikungunya, the pain should resolve in a week to 10 days. And when you have these pains, don't take NSAIDs like ibuprofen and aspirin and Dispirin till dengue is ruled out. It's very, very, very important that you differentiate that what you have is not dengue, because it has very similar clinical features. It's transmitted by the same way.
But Samir, how does one know if it's dengue or chikungunya? Because also you've been mentioning paracetamol, but isn't it important that you absolutely do not take aspirin, which is why one must know whether you have dengue or chikungunya, correct?
Yeah, so absolutely. So that's done by simple blood tests.
Okay.
The difference is that dengue virus actually gets detected pretty early, but chikungunya's virus does not get detected that early. Sometimes it can take up to a week.
No, but can you self-prescribe? Can you go ahead and take a paracetamol or an aspirin
not
without
an aspirin,
knowing what it is?
Not an aspirin, definitely. But if somebody is having fever, paracetamol is typically, which comes as Dolo, Crocin.
Correct.
That can be prescribed.
So do not take aspirins. That's the one thing we want to tell all of our viewers. Definitely do not take aspirin. Avoid that.
No ibuprofen, no diclofenac, nothing. Only thing you can take is paracetamol, and then go to your doctor so they can check you out and make sure,
what it is.
Yeah.